Hey friends, I'm Yash and I welcome you to the first episode of MedTech Annals, a series where I distill and assimilate some of the key aspects, learnings, and scopes in the medtech industry. Today, I'll be introducing the concept of humanizing healthcare, talking about the patient spectrum, how we can make a patient-centric system, and more importantly, how we can empower patients in different treatment environments. Timestamps to everything is in the video description, so do feel free to skip around. If you prefer reading all of this rather than passively listening to it, this entire video will be available in article format on my blog, which is linked on the screen right now. It will also be in the video description and pinned comment. So this is going to be the structure of the video. In the first part, I'll be talking about humanizing healthcare, covering why we need to humanize healthcare and for whom we need to do so. This will also include a bit of discussion about the natural support network. In the second part of the video, I'll be using the bit about humanizing healthcare to discuss how we can empower patients in different treatment environments, talking about psychosomatic risk and bringing the hospital into the 21st century. Having said that, let's jump straight into part 1, humanizing healthcare. As I said, before we answer how to humanize healthcare, we must answer and understand why we must do so in the first place and for whom are we doing so. Now, to answer the first question, why humanize healthcare? To give a reasonable answer to this open-ended question, we must understand that the quality of healthcare is measured by one singular matrix, the outcome it produces. In our current national healthcare systems, the outcome of healthcare is highly variable. It changes from district to district, hospital to hospital, and even from doctor to doctor. What this results in, apart from a diminished confidence in our own healthcare systems, is a booming medical tourism industry. The industry which deals with patients traveling abroad to receive medical treatment. If we look at the medical tourism industry in its current state and projected numbers, it's easy to infer that most of us as patients have accepted this healthcare outcome variability. This acceptance has led to subconscious thinking such as one doctor is better than the other, or one particular clinic in a particular hospital is better than the others. Though these thoughts are justified, we don't realize how they worsen our own experience with the healthcare system. The presence of outcome variability is the reason why we need to humanize healthcare. Even if we ignore outcome variability for a moment, we should realize that different cogs in our healthcare system do not necessarily synchronize. A good example of this can come from the UK's National Health Service, where the lack of standardization in color codes for patient samples have led to some terrible mistakes. Different patient samples are color-coded differently. These color codes usually specify the nature of the patient sample or the nature of the test to be done on the patient sample. When you're still a junior doctor, i.e. a doctor in training in the NHS, you rotate from hospital to hospital in a given year. When you're working in a system which forces you to use different color codes in every quintile of the year, errors are bound to happen. As a doctor, you could incorrectly categorize a patient sample or send an incorrect patient sample to the lab. Now, this is obviously not ideal. You end up wasting time, and in the worst case scenario, patients need to come back into hospital to give their samples again. In short, what this example demonstrates is the existence of poor care coordination systems in the most fundamental and basic aspects of our healthcare systems. It is this lack of integration, information sharing, and coordination between every doctor, nurse, patient, and stakeholder of the healthcare industry that prompts the need to humanize healthcare. This is worsened by disconnected relationships between each stakeholder, driving poor outcomes, both in terms of the quality and cost of healthcare. In the end, what you're left with is healthcare consumer vulnerability. That's the crux of the problem and trigger for healthcare disaster. So now that we have understood why we need to humanize healthcare, we need to understand who we are humanizing healthcare for, i.e., which kind of patient are we targeting? Ultimately, the healthcare industry is built by businesses, and you want to be spending time creating solutions for the initiated. There are mainly 6 types of consumers that the healthcare industry would come across. The first and ideal consumer is the activated consumer, someone who has leaned in completely, taking full charge of their own health and wellness. The next type of consumer is the engaged consumer, someone who is able to but chooses not to actively lean into their own health and wellness. Furthermore, we have the encouraged consumer, someone who initially ignores their health but proactively takes care of it when faced with an ultimatum. For example, someone who decides to exercise every day after suffering from high blood pressure and a cardiac arrest. In some cases, you would also see the unengaged consumer. There is nothing I have to say about this particular consumer in specific, but he or she is someone who does not really care about their health and wellness. The next type of consumer is the defeated consumer. This is not the worst kind of consumer the healthcare industry will face, but on a mental note, they are the most pessimistic individuals who feel their life is done for when faced with an ultimatum. For example, someone diagnosed with Parkinson's, while lucid, thinks I have nothing to live for and nothing to accomplish. Arguably, the worst kind of consumer the healthcare industry will need to face from a business standpoint is that of the terrified consumer, someone who is terrified and hence avoids the healthcare system entirely. This can be seen most evidently with vaccine skepticism and more recently with the pandemic, where most of us were and still are to some degree scared of going into a physician's office or a hospital for that matter. A terrified consumer is not only worried about whether he would catch a novel coronavirus or whether a doctor would do something against their religious beliefs. The terrified consumer may also be terrified of overburdening or being a burden on the healthcare system. The thought, what if I go there and there is no doctor available? So which kind of consumer will the healthcare industry prefer? Surprisingly enough, industry leaders have reached a consensus that the best form of patient is the activated patient, a patient who proactively leans into their health and wellness. Why would the healthcare industry prefer the initiated or activated consumer over someone who is, say, unengaged? Surely the activated consumer would want to spend less time in hospital, if any at all. Ultimately, he does take care of his health and wellness. The notion that the healthcare industry wants you to stay in hospital for as long as possible is partly true but overwhelmingly false. The healthcare industry does not, or at least should not, look at patients as a frail being responsible for their income. Again, the consensus between industry leaders is that the patient is a majority stakeholder in the industry and a partner to the healthcare system. Now, there does exist literature on a concept called patient as partners. As quoted from a 2015 paper, the patients as partners concept is where the patient is considered a full-fledged partner of the healthcare delivery team and the patient's experiential knowledge is recognized. The line about the patient's experiential knowledge hints towards a growing notion in healthcare that patients should contribute or make state or national healthcare policies. This is obviously based on their unique experience of being a patient. Here's what another quote from the same paper has to say about the effectiveness of the patients as partner theory. Patients' experiential knowledge and competencies developed through their illness experience must be recognized as a positive and complementary contribution to their healthcare. What I need from someone walking through the hospital gates is for them to be able to work with doctors, nurses, technicians, and analysts so that they can serve the patient to the best of their abilities. I'll link the study in the description below. It does show some of the common woes that we have as consumers and patients in the healthcare industry, and is again put forth the idea that for the healthcare system to be effective, it must treat the patient as part of the treatment plan rather than a consumer of it. So before we move on to talking about the natural support network, let me do a quick recap. We talked about why we need to humanize healthcare and the 6 different types of patients. We discussed that the lack of coordination and integration between different parts of our healthcare system has led to healthcare outcome variabilities, which places the quality of healthcare and by extension the effectiveness of the healthcare industry into question. Now this can be solved by simply humanizing the healthcare system and targeting the activated consumer. Though this solution does sound simple, there is a significant issue. The activated consumer is an ideal, and does not exist. No one is completely activated and dedicated to invest in their mental and physical health. So what do we do? What's the alternative? The alternative is to realize that a patient does not only bring himself into the healthcare system, but brings along with him an army of sorts. People who provide, pay, and emotionally support him throughout his healthcare journey. It is this army of individuals the healthcare system should talk about and ponder on. We can call this army the natural support network, as wittingly put by Dr. Summer Knight in her book about humanizing healthcare. After all, people are the foundation of humanizing healthcare and are key to forming what Dr. Knight says to be a therapeutic alliance. This is a shorthand for a bond between the healthcare consumer, their healthcare team, and their natural support network. Crucially, this is based on a mutual sense of caring and focuses on working towards a singular goal, which happens to be optimizing the healthcare outcome. Achieving this therapeutic alliance and forming the basis of humanizing healthcare is a three-pronged approach. The first one is care augmentation. Quite literally, it means amplifying care, both in terms of the cost effectiveness of it and the healthcare outcome. This would also include product developers, financiers, suppliers, and regulators that support this industry. Basically, the presence of a really strong behind-the-scenes network. Another way to humanize healthcare is focusing on healthfulness services. Healthfulness services are care-focused services that are made up of clinicians, guides, and health communities. The last way to humanize healthcare is to build infrastructure. Though there has been a transition to digital technology in the COVID age, firstly, it has not been sufficient by any measure, and secondly, it is bound to collapse on itself due to the absence of an infrastructure behind to support it. What kind of infrastructures I'm talking about? I'm talking about platforms, data, and insights which form the backbone of literally every healthcare system. In the end, to conclude this really long segment about humanizing healthcare, we should try and do so on three levels. Number one, the level of relationships, creating therapeutic alliances that help activate the consumer. Number two, organizational relationships, where the organizational structure and operational culture of the system promotes humanizing the healthcare system. Number three, macro environment relationships, basically asking ourselves how we can achieve a humanized state across the industry, both on a national and global level. So that brings us to the end of part 1. Let's move on to part 2, healthcare environments. Humanizing healthcare also involves a shift in provider mentality from the goal of a patient surviving to the goal of a patient thriving. The goal of any healthcare system should not only be to cure a patient of a disease, but to enable the patient to live a more fruitful life after their treatment. To enable this experience, however, providers will need to think about two things. Number one, how they will actually do it, and number two, the psychosomatic risk. The first question is easy to answer. How will the provider provide quality of care and life? Well, they will do so with an ecosystem backing them up. An ecosystem comprising of the private and public sectors, along with collaborations with financiers, regulators, providers, and more. The second one, about psychosomatic risk, is rather complicated. Psychosomatic risk is defined as the inherent risk of telling a patient about their disease. Instantly and quite naturally, this would cause a polarizing response, leading to valid concerns about the ethical and moral nature of not disclosing information to a patient which may be vital to his or her survival. A more aware individual may pose the argument that when given an ultimatum, disclosing life or death information may cause psychological distress to both the patient and their families. The best way to reduce psychosomatic risk is to treat the patient in an environment where he or she is most comfortable in. In most cases, this would be their homes. In many ways, treating a patient at home has been considered to be more effective than traditional hospital treatments. If you look at dialysis as an example, arriving at a dialysis center 3 or 4 days a week for 3 or 4 hours each session will not only take a ridiculous amount of time, but would also drain your physical and mental energy. Hypothetically, if dialysis machines could be made more portable and more affordable, they could be delivered to a patient's home so that they could get their dialysis done during the night while they sleep and actually wake up fresh and do more of what they like. The simple message here is that hospitals and outpatient services cannot be allowed to treat patients, especially those with chronic diseases, in a 20th century environment. This ties in with humanizing healthcare, as the expectation is that a patient walks into a healthcare system which is able to diagnose and manage chronic illnesses with 21st century technology. This is not a radical proposal and should be made more mainstream. In short, the healthcare system must evolve from a business designed to provide care to a business that is paid to deliver value and care. Caring for a patient is surprisingly short term, but if the system focuses on providing value to patients, it can be more beneficial in the long run, especially in the context of health and wellness. So with that, we come to the end of a very long video. To summarize, we have talked about humanizing healthcare and how we can bring the hospital to the patient in the 21st century. We have discussed the ideal healthcare consumer, someone who is inclined and actively works towards taking care of their own health and wellness. More importantly, we have also discussed how this particular consumer can partner with the healthcare system rather than be a passive consumer of it. As the ideal consumer is only ideal and does not really exist, the healthcare industry should focus on the natural support network or the army of people a patient brings into the healthcare system. The most effective nature of healthcare will be to shift from care delivery to value delivery, obviously keeping in mind the financial viability of the value provided and the psychosomatic risk to the patient and their dearest. So I really hope you liked this video, and if you found any value from it whatsoever, do consider hitting the thumbs up and possibly leaving a comment. Thank you so much for watching, and I'll see you in the next video, which will talk about interoperability and access to care. If you have any questions, do feel free to leave them in the comment below. I will try and answer them with whatever knowledge I have, hopefully providing evidence from papers and academic studies. Do consider subscribing if you have not already, and I'll see you in the next video.